Hello class, today we're going to talk about chapter 4, which goes over antibiotics and antifungal medications. Our chapter topics today include fighting bacterial infections, storage of liquid antibiotics, ophthalmic antibiotics, sexually transmitted infections, fungi and fungal diseases, and complementary and alternative therapies. Our learning objectives include describing the differences between bacteria and fungi, identifying the major types of antibiotics by drug class, determining which auxiliary labels to use when dispensing major types of antibiotics and antifungals, defining therapeutic effects, side effects, contraindications, and administration routes of major antibiotics and antifungals, utilizing appropriate antibiotic and antifungal general drug terminology and written and oral communication, describing treatments for commonly sexual transmitted infections, discussing storage requirements of liquid antibiotics, and listing common ophthalmic antibiotics. So first, let's talk about fighting bacterial infections. Bacteria are single-celled organisms. Not all of them are bad. Pathogenic bacteria are bacteria that are harmful, and infection is tissue damage caused by the presence of bacteria or their toxins. Many times bacteria names are abbreviated in the workplace, especially in a hospital setting. You'll probably hear things abbreviated, such as strep pneumo and C. diff or E. coli. So there's different types of bacteria. There's aerobic bacteria, which need oxygen to live. Anaerobic bacteria can survive without oxygen. And different shapes of bacteria, Kochi, bacilli, and spirochetes. And gram-positive bacteria will have a thick cell wall which absorbs crystal violet, and gram-negative bacteria which have a thin cell wall which does not absorb crystal violet. Bacteria are said to either be gram-positive or gram-negative. This classification comes from a staining technique named after its developer, Hans Christian Joachim Gram. In this technique, a purple stain called crystal violet is applied to the bacteria, and then they're viewed under a microscope. Gram-positive bacteria have a thick cell wall, and it will absorb that purple stain, and gram-negative will not. Symptoms of bacterial infections include a fever greater than 101 degrees Fahrenheit and elevated white blood cell counts. Antibiotic treatment and action. An antibiotic is a chemical substance with the ability to kill or inhibit microbial growth, and it interferes with biological processes inside bacterial cells. If you can hear that lawnmower in the background, I apologize, but my neighbor is mowing his yard, and so sorry about that. Hopefully he'll be done soon. There's different factors to be considered in antibiotic selection. One is a type of pathogen suspected, antibiotic spectrum of activity, and the location of that pathogen. When it comes to identifying bacteria and selecting drug treatment, you can take a sample or a swab from the patient. Then that sample is then grown in a laboratory culture, and that culture and sensitivity test is performed. Nosocomial infections are acquired while in a hospital or nursing home, and they're often resistant to antibiotics and difficult to treat. They're also referred to as healthcare-associated infections. Those can be hard to treat because the bacteria are already known to be resistant. A bacterial agent is an antibiotic which bactericidal agent, is an antibiotic which kills an invading organism, and bacteriostatic agent is an antibiotic which inhibits the growth of that bacteria. Evaluating the outcome of the antibiotic treatment involves clinical response and microbiologic responses. let's see. There's different major classes of antibiotic drugs, sulfonamides and nitrofurantoin. They work different ways, but there's different charts here that we'll go over more in depth in your textbook. Penicillin is one of the oldest antibiotics that's used to it treats a wide variety of different bacterial infections, and the way it works is it kills bacteria by inhibiting the formation of their cell wall. There are some nasty side effects that involve your GI tract, though: stomach upset, diarrhea, different things like that. There's some other major classes of antibiotics that fall under the penicillin category. There's amoxicillin, penicillin, nafcillin, oxalicillin. Those are ones that you're going to see a lot in a hospital setting, especially the piperacillin and amoxicillin clavulanate. That's a combination medication that's called Augmentin. You'll see that a lot to treat pediatric patients in a retail setting. Cephalosporins. They kill bacteria by inhibiting the formation of the cell wall as well. They have a similar action to penicillin, but they differ in their antibacterial spectrum, resistance to beta-lactamase, and pharmacokinetics. Here's some examples of common cephalosporins: cefazolin, Keflex, Cefalcor. These are ones that you'll see both in a hospital setting and a retail setting. A safety alert here is to alert the pharmacist and prescriber if a patient who's allergic to penicillin is prescribed a cephalosporin. Even if the prescriber wants the drug dispensed, it's important to document this communication in case the person does have a cross reaction. A lot of times patients who are allergic to penicillin also have a cross sensitivity to cephalosporins. So, to determine whether a patient experienced an allergy or a side effect, what should you ask the patient? You should ask the patient to describe the reaction of the drug in question. If the patient reports mild stomach upset or diarrhea, you may want to investigate further since these are side effects of penicillin. So an allergic reaction could be something like swelling or an anaphylactic shock, whereas a side effect would just be like GI upset, or sometimes things can leave a bad taste in your mouth, things like that. Those aren't true allergies. They're just adverse drug reactions. We also have carbapenems and monobactams. You're going to see these a lot in a hospital setting. They're grouped together here because they differ only slightly in their molecular structure from penicillins and cephalosporins. These drug classes kill bacteria by inhibiting the formation of the cell wall. And here, let's see, in this next one, they talk about meropenem and ertapenem. Those are very common in a hospital setting. It's important that they be given around the clock. They're usually given every 8 hours. And you'll see a lot of those, especially if you work in a larger healthcare facility like UK. Vancomycin here is the mechanism of action is not fully understood. It most likely inhibits cell wall formation, but it can cause red man syndrome. And there's a picture of that there on the right of your screen. And red man syndrome is associated with vancomycin infusion that results in flushing and redness in the neck and face, rash, and hypotension. This patient is having a pretty severe reaction, red man syndrome. I've not seen one that bad. So now we have lincosamides and macrolides. They block bacterial ability to produce needed proteins to survive. A lot of these are used, especially the lincosamides for acne. They can be given orally or in topical creams. For example, that lincosamide there is clindamycin. Cleocin topical ointment or gel is often used for severe acne. The azithromycin Z-Pak is an example of a drug that is supplied in a dose pack but can be dispensed from a bottle. The 250 milligram and 500 milligram tablets can be dispensed in a bottle or as a package. Just put these same instructions on the label and use the strength of the drug that is in the package. Macrolides, the most common one that you're going to see, especially in a retail setting, is going to be azithromycin. And in a Z-Pack, those come pre-packaged in a unit dose, and the first dose will be 500 milligrams, and then the following doses will be 250 milligrams. So aminoglycosides, they kill bacteria by blocking their ability to make essential proteins for survival. They're often used in conjunction with other antibiotics such as penicillin, cephalosporins, or vancomycin. Tetracyclines. They're another class of drug for bacterial infections, and they are bacteriostatic drugs that inhibit protein synthesis with bacterial cells. Consequently, they require a functioning immune system to cure infection. They are broad spectrum, and there's more information in your textbook on page 87 about tetracyclines. But one nasty side effect is that they can cause permanent discoloration of your teeth if you take tetracycline for an extended period of time or take it frequently. And in fact, my dad has a penicillin allergy, so he was given tetracycline to treat Lyme disease when he was young, and it caused permanent discoloration of his teeth, and he actually had some dental work done in his late 30s to get caps on his teeth because they turned like kind of a brownish orange color. There's actually a picture of that on page 88 of your text. Fluoroquinolones. They kill bacteria by inhibiting the enzyme that helps DNA to coil. If the DNA can't coil, it's rendered useless and the cell dies because it can't function. Quinolones have strong rapid bactericidal activity against gram-negative bacteria and some gram-positive bacteria. They're usually used to treat bone and joint infections, eye infections, UTIs, or anthrax. Metronidazole. It's used to treat amoebic dysentery, bacterial vaginosis, H. pylori. There's several that are listed there. It can have some pretty nasty side effects too, including headache, anorexia, vomiting. See, our next class is linazolid, and inhibits bacterial protein synthesis, and it was the first oxylinodone approved by the FDA, and it inhibits bacterial protein synthesis. It needs to be protected from light, so in your textbooks, there's actually, by each of these groups of drugs, there's actually the applicable auxiliary label that you need to attach when dispensing these different medications. Daptomycin. This is another one that you will see very commonly in a hospital setting. It's used to treat skin and skin structure infections. So what are the main classes of antibiotics? So we have sulfonamides, penicillins, cephalosporins, carbapenems and monobactams, macrolides, aminoglycosides, tetracyclines, and fluoroquinolones. And which class of antibiotic is known for its potential to cause nephrotoxicity and ototoxicity? That would be aminoglycosides. So some antibiotics come with specific storage requirements. Some need to be stored at room temperature, and then some need to be refrigerated. It's important to be aware of which ones need to be refrigerated after reconstitution and which ones can stay at room temperature, and put the appropriate auxiliary label on those. Another responsibility of the technician is to add medication flavors if the patient or patient caregiver requests that. This increases adherence in children. If you have a bitter tasting medication, you can add like grape flavoring or bubblegum flavoring to make it more palatable. So true or false? All antibiotic suspensions must be stored in the refrigerator. That is false. Storage requirements are agent specific, and some antibiotics may be stored at room temperature. Right, ophthalmic antibiotics. Some of the antibiotics discussed in this chapter have an ophthalmic or eye dosage form. In contrast, there are very few antibiotics that actually have an otic form because the ophthalmic forms are often used for ear conditions. However, otic medications are never used in the eye. This would be extremely painful because otic medications are not manufactured with the same pH, or the acidity or alkalinity is different than it would be for an ophthalmic medication. Sexually transmitted infections. Definition here is a genital system infection transmitted by sexual activity. They are formerly known as venereal diseases, and they're pretty easily prevented. Abstinence is the best form, but long-term monogamous relationships with an uninfected partner is another. Also, prophylaxis helps as well. We'll just go over briefly these sexually transmitted infections. If you want to read more about those, it begins on page 94 of your textbook. So we have chlamydia, gonorrhea. Those can be infected by your partner, but they're pretty easily treatable with a course of antibiotics if you're diagnosed. Syphilis is, there's different stages of syphilis, and unfortunately, if that goes untreated for long term, that actually can be fatal. There's some more description of these, like I said, in your book, if you wanted to read more about those. Agents for treating sexually transmitted infections, azithromycin, ceftriaxone, tetracycline. Those are all really common antibiotics used to treat different sexually transmitted infections. What is the treatment choice for syphilis? Penicillin G, bensanthine. And fungi and fungal diseases. Fungus is a single-celled eukaryotic organism. It has a defined nucleus. This includes mushrooms, yeast, and molds. The way they differ from green plants is they lack chlorophyll and they reproduce by spores. How they differ from animal cells and bacteria is they have a rigid cell wall. And they differ from human cells because human cell membranes contain cholesterol, where fungi cell membranes contain ergosterol. There's different fungal diseases. That's in page 97 of your textbook. It starts to talk about fungi and fungal diseases. Most are mild topical infections. They include dermatophytes and candida. And serious systemic infections can also happen, but they're more common in people who are immunocompromised. Amphotericin B is one that you will see very commonly in a hospital setting. It's used to treat life-threatening fungal infections. It's given IV, and it has some very specific compounding instructions. It's also incredibly expensive. This group of medications is called polyenes, and they are they're also lipid-based, so they have a phospholipid bilayer around the cell. A lot of drugs are you can tell what drugs are classified as by the last several letters in the names. For example, this one is azoles. These are antifungal medications. The way they work is they inhibit the formation of the cell wall, and they include clometrazole, ketoconazole, fluconazole. These are all very common medications, and actually clotrimazole is available as a vaginal cream over the counter. Actually, down here it says, put down roots. Many antifungal names end in zole. If the generic form of the drug ends in zole, especially conazole, there is a good chance it will be antifungal. The only one I can think of off the top of my head that ends in zole that is not an antifungal medication is pantoprazole, and that's a PPI for GERD. Echinocandins, they're used to treat invasive candida and people who are unresponsive to itraconazole or amphotericin. Classification is, or an example of this is micafungin. This is also very commonly used in a hospital setting. There's different miscellaneous antifungal medications here. Butenofine, cyclopyrox, terbinafine. These are ones that are less often used, either because of the side effects or just because they're just like a last resort medication. So provide therapeutic uses for the azole class of antifungal agents. Oral candidiasis, vaginal candidiasis, skin infections, nail infections, and oropharyngeal or systemic infections caused by candida. There's also complementary and alternative therapies that should be considered. Echinacea actually increases phagocytosis, the process by which the immune cells eat up foreign cells such as bacteria. It also enhances lymphocyte activity. It's used to treat common colds and vaginal yeast infections. It doesn't cure it, but it will reduce the severity and length of the symptoms. This is available over the counter, as well as zinc, which is used to enhance wound healing and prevent wound-associated infections. And the Chapter 4 summary. A bacteria is a single-celled organism that can cause infection in the body. Bacteria can be classified by oxygenation need, shape, growth, arrangement, and Gram-stain results. Several major classes of antibiotics and antifungals are available, which vary in the spectrum of activity, side effect profile, contraindications, and drug interactions. Some antibiotic suspensions are stored in the refrigerator, while others may be stored at room temperature. Ophthalmic antibiotics have strict manufacturing requirements, which may result in increased expense. Several sexually transmitted infections may be treated with antibiotics. Drugs that fight bacterial infections generally will not work for fungal infections.